Great.
Good morning. Can you hear me?
Yes.
Great. Apologies for the technical issues and for keeping everyone waiting.
Oh,
Hope I can
well,
make for it with the remaining time.
let's get going. Let me introduce you. So I am now on video and on audio. What I'd like to do now is introduce Dr. Leo Trasande. So Leo is an eminent pediatrician, the Jim G. Hendrick, MD professor, director of the Division of Environmental Pediatrics and vice chair for research in the Department of Pediatrics at NYU School of Medicine. He also serves on the faculty of the NYU Wagner School of Public Service and the NYU College of Global Public Health. He's a very busy guy. Dr. Trasande is an internationally renowned leader in environmental health. His research focuses on the impacts of chemicals on our hormones in our bodies. He also has led the way in documenting the economic costs of regulators' failures to use modern science in their flawed efforts to determine what is safe and what is not in the field of endocrine disruption, thus allowing widespread human exposure to hazardous chemicals at doses that have adverse effects. In addition to all this, Leo has been a leader in communicating to the public about endocrine disruption and related science. He has appeared repeatedly on national morning talk shows to help viewers understand the scientific and medical dimensions of endocrine disrupting chemicals. And in 2019, he published a marvelous book, Sicker, Fatter, Poorer, which tells the compelling story of a pediatrician, Leo, bearing witness to EDCs through his pediatric practice and research. You can learn more about the book at Leo's website, leotrasande.org. Now, I'd like to ask Leo to share his screen and begin, and I apologize for the technical difficulties that kept us from beginning on time.
Thank you, Pete. I apologize as well. In these pandemic times, some technical issues, even under the best of circumstances, always seem to arise. So thank you. I hope to make up for it in the presentation. I'll begin with just a number of disclosures. I did receive a book honoraria relating to Sicker, Fatter, Poorer, and I do serve as a scientific advisor to a number of nonprofit and other organizations. So I'll begin. Many of you may know the basic definition of an endocrine disruptor. Endocrine refers to our signaling molecules that underlie so many basic biologic functions, from temperature to salt, sugar, and sex. And natural molecules, hormones, mediate those signals, and endocrine disruptors are synthetic chemicals that scramble those molecular signals and thereby contribute to disease and disability. Originally, the hypothesis was that you had to directly impair receptor function or block a receptor to cause a perturbation. And originally, we thought that you had to essentially see an effect in an otherwise unexposed human, that it was a single exposure. Unfortunately, the more we understand, the more we realize that the mechanisms are many and sundry. They involve changes to not the genome itself, not the ACGT code, but the signals on the gene that thereby contribute to gene expression, as well as a host of other basic mechanisms. So it's much more simple than whether you block a receptor or not. And the effects really occur in the context of a chemical soup in which we all are exposed to many of these synthetic chemicals that have interacting effects. So it's not quite as simple as we originally anticipated when we first started to understand the notion of endocrine disrupting chemicals. As this slide elucidates, there are many chemicals that are ubiquitous in the lifestyle of a human on this planet. And there are natural chemicals that do also have hormone activity that are also in the mix. the work I'm going to present really stands on the shoulders of giants, stands on Pete's shoulders through Our Stolen Future, stands on the work of the Endocrine Society, the first scientific statement in 2009 following the Wing Spread Conference back in 1992. So we're talking about 20 years of research with rapid acceleration of knowledge regarding the effects of these chemicals on human health. The World Health Organization, United Nations Environment Program, followed up on the 2009 Endocrine Society statement with an even more striking report putting this issue on the roadmap as a global public health issue. In 2015, we put together a series of expert panels to try to elucidate what the disease burden and economic costs of these chemicals were first in Europe and then in the United States. We developed ranges for the fractions of disease that could be attributed for 15 exposure outcome relationships. We adapted the state of the art in interpreting the strength of the epidemiologic and toxicologic evidence, and we adapted the Intergovernmental Panel on Climate Change's approach to integrate the epidemiology, the human studies, as well as the toxicology, the laboratory studies, and estimate probabilities of causation for each of these relationships. I'm not going to be able to go into all the details of the calculations and the methods, but what we found were that endocrine disrupting chemicals in Europe cost the economy 163 billion euro. That's 209 billion US dollars. That's 1.2% of its gross domestic product. And those estimates represent only 5% or less of endocrine disrupting chemicals that are known, a subset of diseases to the few chemicals we studied, and a subset of costs due to those same diseases to the same chemicals we studied. So this was an underestimate of an underestimate of an underestimate. We followed on those studies later, publishing in Lancet Diabetes and Endocrinology in 2016. About a year later, looking at the US costs, and they were even higher, $340 billion, 2.3% of the gross domestic product. That's in part due to the American legacy due to the California law that required flame retardants be added to every piece of furniture in the United States and the rest of North America, leading to huge discrepancies globally in the levels of brominated flame retardants compared to anywhere else on the planet. But that was 2015 or 2016. So this is a rapidly accelerating field. The second Endocrine Society scientific statement came right out around the time we did those first economic estimates in Europe. With 1,331 scientific references, the American Academy of Pediatrics had a scientific statement on food additives in 2018. So this is a rapidly changing field. Our estimates back in 2015 didn't include perfluoroalkyl substances, which they essentially have exploded coming onto the scene. Yes, there was a C8 report looking at very high exposures, but that wasn't as much translatable to general populations and low-level exposures at the time. And our work only focused, as I mentioned, on a limited scope of outcomes. There's new science evolving, suggesting that the breadth and depth of the impact of endocrine disruptors is even wider. And we hadn't looked at birth outcomes as a priority area previously. So what we did was to perform first a scoping review to inform future research and policy. We focused specifically on chemicals that are currently in circulation and not on already regulated or what so-called legacy compounds. We really were emphasizing newer chemicals that were actionable. And I can't underestimate the size of the task that we took on. I'm just giving you on the right from the paper itself, the general approach to the search terms. Essentially, we had to do dozens of subsets of search terms and really combing thousands of scientific articles and really screening abstracts. And this was very much a team effort. In particular, that was led by Linda Gross-Kahn, a postdoctoral fellow in my group at NYU Grossman School of Medicine. Claire Philippot at INSERM in Grenoble was a key player in this effort, supported by Remy Slama, and Shoshi Nakayama from the Japanese Ministry of the Environment was also a really crucial contributor in this work. So let me walk you through the results. I'm going to let the tables do most of the talking here and go outcome by outcome. So over the past decades, you could argue, there had been mounting evidence suggesting that PFAS decrease birth weight through intrauterine growth restriction. That evidence has been debated substantially. There are multiple meta-analyses with consistency. There are some people who question some of the timing of these effects, but this is a very robust literature at this point. I'm admitting that we have not formally assessed the probability of causation and the strength of the human evidence. That wasn't the focus of this exercise. That probably would have been the focus of multiple other quasi-systematic reviews or expert panel assessments. But suffice it to say, that wasn't the only outcome associated with EDC exposures. There have now been multiple studies identifying phthalate exposures in utero shortening gestation, in particular focusing on metabolites of diethylhexyl phthalate, though there are emerging replacement chemicals for that group that are potentially suggestive. And the work of Shauna Swan and many others have suggested that phthalates shorten anogenital distance in male offspring, which is a predictor of infertility, among other adverse health outcomes. Again, a theme what you're going to see here is not every study shows the same association. There are many factors. I, as an epidemiologist, always remark that we are using a hoe and a butter knife to attack a potent foe in understanding links between exposures and effects. And so it's remarkable what little we find, as much as there are many people who will say that some of these results are confounded or explained by other exposures that coexist as well. So these are the contexts in which we live. We can't run randomized control trials to assess attribution here. For neurodevelopmental dysfunctions and disabilities, in 2015, we had already addressed a substantial amount of the state of the evidence at that point. And at that time already, there had been robust evidence for flame retardants and organophosphate pesticides. What's emerged more recently are additional studies to confirm those associations, and multiple studies in particular showing effects suggestive for autism spectrum
Leo?
disorder. Yes.
Yeah. I have a request from attendees. If you could switch from presenter view to a full screen view, they'll be better able to see the
would that be better?
Perfect. Thank you.
No worries. Sorry, I'm on a different PC. That was my technical challenge for the morning. And so I'm happy to switch. Thanks. So suffice it to say that, again, here, not all the studies are uniform because of the relatively low incidence of these conditions, autism and attention deficit hyperactivity disorder. The reality is that these studies are often underpowered and are utilizing weak tools to assess exposure with sufficient precision. But there are, suffice it to say, more studies now suggesting those same effects. For metabolic outcomes, this is where the evidence has particularly exploded. In 2015, we had focused on prenatal DDE and its effect on childhood obesity, as well as BPA. And we had also focused on adult obesity and adult diabetes due to DEHP and adult diabetes due to DDE. We identified substantial evidence to support the notion that the PFAS were contributing not just to childhood obesity, but perhaps to impaired glucose tolerance. Now, those go hand in hand to some extent. If you have a mother with impaired glucose tolerance, the child is subsequently more likely to become obese, depending upon the severity of that impairment. The PFAS were also associated with adult obesity in the context of the later life stage adult exposure. So already you've seen the PFAS emerge as a substantial contributor to metabolic disorders across the lifespan. In addition, we identified phthalates as contributors not only to impaired glucose tolerance in the context of prenatal exposure, but prenatal and peripubertal phthalates associated with childhood obesity. And adult exposure to bisphenol A and bisphenol S, which is a theme that we're going to encounter as we go through this presentation. The replacement chemicals are already starting to show signals of their effects in the same way that the so-called initial wave of endocrine disruptors had, suggesting serious policy implications, as we'll talk about towards the end. For male reproductive effects, some of the most striking associations that had emerged were those of prostate cancer in the context of occupational pesticide exposure, decreases in semen quality due to adult exposures to PFAS, as well as organophosphate pesticides, as well as bisphenol A and bisphenol S. We had already suggested that phthalate exposures were associated with decreases in testosterone, contributing to an early mortality, as well as male factor infertility. For female reproductive health, here's again where the PFAS emerge along with bisphenol A as a contributor to a new condition, polycystic ovarian syndrome, new condition with respect to endocrine disrupting chemicals and their contribution, not new condition, period, with multiple studies showing serious concerns. And new studies suggesting that not just phthalates as contributors to endometriosis, but the PFAS as contributors. And here, again, there was one study showing association with one of the replacement chemicals for the long chain perfluoroalkyl substances, PFBS, which is a 4-carbon perfluoroalkyl substance. So again, the theme of chemical whack-a-mole is already starting to rear its ugly head in human studies. And I should emphasize, our review was intended only to focus on human studies, which really limits our view of the potential for causality, as often the human studies follow what we find with positive findings in adult studies. So that's a very quick synopsis of our human studies review. Where do we go from here? We need systematic review and meta-analyses of the observed associations. We need assessments of probability of causation. In some ways, those 2015 estimates are dusty, and disease burden and cost re-estimation is urgently needed. But fundamentally, we have to ask ourselves, is this enough? And that's where the accompanying manuscript really comes to bear. And in this regard, I'm privileged to have had the support of Chris Cassotis, who's now at Wayne State University as an assistant professor, and Laura Vandenberg at the University of Massachusetts. They were crucial collaborators supported by Barbara Demonex, Mikhail Porta, and also Remy Slama. We began first by taking a snapshot of US and EU approaches. Now, the reason for that is not our previous work, but the reality that the preponderance of the literature at this point, or the preponderance of policy action, has been in those two contexts. Now, in Europe, I would say the shining light is in Europe, fundamentally, when it comes to policies with respect to endocrine disruptors. And that's to say it's perfect. Largely, it's a hazard-based approach. There are some exceptions to the hazard-based approach. In particular, cosmetics is still a whole, not to mention food packaging, food contact substances, and medical devices. But when you compare that policy framework to the United States, there's some gaping and glaring concerns. The United States takes a risk-based approach, which incorporates exposure, which means that one has to document that the exposure at a given level contributes to disease, and that must be considered as alongside other factors and trade-offs, sometimes even economic factors to be considered. Now, for pesticides, in particular, there was an effort on the Food Quality Protection Act to put into place a rigorous screening approach for EDCs, but that's not really happened. And at that time, it was only for estrogenic EDCs. So it's a very 1996 version of scientific reality. We know now for sure about androgen, thyroid, not to mention nuclear receptors and a host of mechanisms that are involved. And for cosmetics, we have the infamous fragrance loophole, where essentially ingredients can be included under the presumption of safety and trade secrets as the cloak. Yet we know that these chemicals can themselves have independent effects, some endocrine, some not endocrine. And though the Toxic Substances Control Act was revised at the end of the Obama administration, TSCA reform did not take into account endocrine disruptors in any way whatsoever. So I want to take a minute or two and just highlight some of these differences with a couple of case studies. And the first is chlorpyrifos. So in the United States, there's particularly an infamous history. It was an early good history in the effort to voluntarily phase out indoor pesticide use. But there's been an epic battle about agricultural use that has a somewhat good outcome in that eventually, after EPA administrators reversed decisions in previous administrations, arguing for insufficient animal evidence, which I find baffling. A court challenge ensued, and then that was essentially finalized regardless of the court challenges. As I said, Corteva announced its intention to cease production in the US, but that doesn't solve the global use of this pesticide. In Europe, evidence won the day, and the approval for the use of chlorpyrifos was not renewed. So this, at least for this one pesticide, the issue has been largely solved. So that speaks to some of the bifurcation in the approach that we've seen historically. For bisphenol A, unfortunately, the US story is somewhat equally concerning in that despite the fact that the NIH and the National Toxicology Program developed a collaborative research study to look at hazard assessment for EDCs in the interest of trying to harmonize data from industry as well as academic labs. In the end, in the execution, there was a lot lacking, and there was a bifurcation again in with a failure to really deal and resolve the disparate results between academics and FDA and industry in those results. In Europe, we've seen substantial advances. It's been designated as a substance of very high concern. Now, the bad news is that ECHA is somewhat limited because that substance of very high concern doesn't apply to monomers or intermediates. So a significant amount has remained on the market for use. So all of this leaves us with a situation where there's been some progress, chiefly in the EU, on endocrine disruptors, but the reality is that policy predicts exposure, exposure contributes to disease, and disease costs our economy. And as I alluded to in the earlier parts of the presentation, the differences in costs of EDCs borne by the US and Europe are driven by differences in substantively in policy. Now, I'll make one other comment before talking about prescriptions. There are other policy frameworks. This is a very busy slide, but it just gives you the sense of the countries that have pursued and what they have pursued in the space. China mentions EDCs, but doesn't really make a plan explicit. The PFAS are banned under the Stockholm Convention. That is the certain long-chain ones, PFAS and PFOA. But the US is not a signatory to that ban, and so we're back to a default of federal versus state activity. And it's worth acknowledging that the states have really made substantial effort in that respect. So a lot of change still remains wanting. There are 4 domains we identified: the needs for testing and identifying EDCs, evaluating the exposures, limiting the exposures through regulations, and establishing an international agency for research on EDCs. So with respect to testing and identifying EDCs, I've already talked about the gaps in our understanding of endocrine modes of action. And you can scan the slides to see the reality that the US regulations are particularly weak, and they really are only addressed for water contaminants. In Europe, there are at least a few more modalities covered, but there are really huge gaps in all the existing frameworks. The OECD has contributed some in the space, though there's some debates about whether the OECD frameworks are too narrowly construed within the context of adverse outcome pathways. But there's hope in that assays to look at various including epigenetic mechanisms, can be validated for inclusion in regulatory requirements in the future. We propose a two-tiered system. That is to say that chemicals go through both tiers prior to approval, that they go through a high throughput in vitro screening method, followed by more sensitive in vivo assays focusing on endpoints relevant to human disease. We acknowledge that Tox21 and ToxCast in the US has not been met with the greatest of success. There are some serious concerns about obesogen detection, for example. On the tier 2 front, a lot of people raised the concern about animal testing. There are a lot of non-mammalian vertebrate models that don't invoke the same kind of political counter-fervor that have findings that are relevant and translatable across to us humans. So there is hope in this framework for ability to improve. For evaluating exposures, a particular flaw we identified was that the United States, through the National Health and Nutrition Examination Survey, and the US with the in the European Union with the growing biomonitoring platform there, offers some hope. But in low and middle income countries, there simply almost are no data in some cases at the country level, let alone at the continent level. And these kind of data can inform estimates of burden of disease, as well as informing educational campaigns about safe and simple steps to limit exposure. We also emphasize that the need for right to know legislation and knowledge about what's in our products is crucial. It's not to say that the public has to interpret every detail, every chemical name, but there are ways to interpret that information and translate it for the general public to understand and take steps forward. A major statement in our manuscript was that we really do need to switch to a hazard-based paradigm. The reality is that there is a huge lag due to disease latency. Non-monotonicity means that conventional risk assessment fails in many cases. You can't extrapolate to no observable adverse effect levels. And yes, I appreciate some risk-based approaches try to account for susceptibility by age and other factors, but they assume some a priori population sensitivity that can simply be calculated, and that's not always the case. There are precedents for hazard-based assessment in Europe, especially for carcinogens, persistent and bioaccumulative and toxic materials, and very bioaccumulative materials, not to mention EDCs, as I mentioned earlier. And I appreciate there's a lot of discussion as this is an industry generated rubric on the right. In the interest of balance, I thought I would at least put that out there. But this to me is a oversimplification about the implications of taking, for example, salmonella or road safety and translating that over to endocrine disrupting chemicals. It does not translate so simply. So we need a process to support that hazard-based paradigm. The first step is to make endocrine disruption part of the globally harmonized system of classification and labeling. We need that two-tier testing paradigm, and we need clear timelines and actions once we find an EDC. And finally, there is an international agency for research on cancer that followed the understanding of carcinogenesis as a hazard-based action point. So we argue either to expand IARC's agenda to include endocrine disruption or the establishment of a separate agency. We argue that IARC was successful. It's been attacked over the years, but it's been successful due to its apolitical nature, its integration rigorously of multiple streams of evidence, and it doesn't explicitly make policy recommendations, but it makes scientific statements that individual countries and individual entities can translate and ultimately implement in their local contexts. The good news is there's a framework for IARE, as we call it. There are key characteristics that have been described in consensus statements. Assays are able to provide information about some of these. That framework can really be used by expert panels the same way it's being used for carcinogens. And one can bring together, I do joke that Leon is a good place to have IARC because of the red wine, but tongue-in-cheek aside, that anywhere can be a place where you can bring together diverse experts to develop collaborative reports that foster that kind of movement. And that would be in line with the post-2020 international movement led by the UN called the Strategic Alliance for International Chemicals Management. So by way of conclusion, we have a doubling in the probable exposure outcome associations due to endocrine disruption with human evidence, with a new, apologies for the typo, explosion in evidence for the PFAS, new effects across a host of outcomes, and strengthening of evidence from many previously identified relationships. There's urgent need for policy action. We need a consensus on identifying EDCs, methods to evaluate them. We need to establish global biomonitoring programs. We need to identify the chemicals on materials and identify which chemicals are endocrine disruptors. We need to include economic costs. The global burden of disease effort by IHME and the WHO doesn't fully account for endocrine disrupting chemicals. We need a hazard-based approach, and we need an international agency for research on EDCs or some similar framework. Thanks for the opportunity. I hope I've made up the time. Pete, should I work through the questions in the chat?
I'm sorry, I was on mute.
Okay.
Yeah, go ahead, Leo. You work through them.
Okay, so I'm going to work on the Q&A first. So what implications do EDCs have on pandemics like COVID-19? Well, so we know that air pollution is associated with increases in COVID-19 mortality. That's likely due to intermediate disease endpoints that increase risk, like obesity, diabetes, and cardiovascular disease. But the PFAS are immunotoxicants. We didn't talk about this because this is a study of endocrine disruption purely construed, but we know there's endocrine immune crosstalk. So in some ways, that's an abstraction. We know that phthalates and bisphenols are speculative immunotoxicants. I think there's limited studies. I think there's some sense of data on Th2 helper 2 type T cells. But suffice it to say, this is an area where there's a lot of research needed. I know there's others pushing that research agenda. There's cause for concern, I would say. You still need to be infected with SARS-CoV-2 to get COVID-19, though.
Leo, let me add something to that. I posted in the Q&A a link to a webinar that Linda Birnbaum, Ali Cohen, and I did in June, specifically on the links between the comorbidities that increase the risks of COVID-19 and endocrine disruption. And it's got some really excellent science and medicine. And I encourage people to look at that webinar. It's hosted by Jay and also Heeds.
Great, and I think I've covered Amy's as a 2-for-1 here. I'm just reading across multiple things. So Haley Golke asks, as a pediatrician, what advice can I give to families to avoid these chemicals during a visit? So I do this all the time as a general pediatrician at Bellevue Hospital. And so Bellevue, you may know, is the flagship public hospital in the New York City system. So we deal with a lot of resource poor populations where there are constraints naturally. So at the same time, they're safe and simple steps that people can take to limit exposure, and it doesn't require a PhD in chemistry, nor has to break the bank. So avoiding canned food, not microwaving plastic, not machine dishwashing plastic, maybe not using plastic period would be a good step, though that may be in certain contexts too far to go. Recirculating the air and using a wet mop to get rid of persistent organic pollutants. Eating organic, especially the leafy greens and vegetables. And the lower priorities are the hard-shelled fruits and vegetables where you don't eat that outer layer, like the avocados. We've seen an explosion in market share that has brought down the costs of eating organic compared to conventional. So this is actually in the big box stores now, and so that really makes more of this feasible. I don't throw, in my practice, I don't throw more than one or two at a given time steps, because much like what I do in medical management of asthma, you take things stepwise and you build people up on what they can do and get them to do the things you suggest well, and then build on that. I can keep going if that's okay. So Meg Sears comments about the whack-a-mole phenomenon. We clearly need to regulate by class. I think that's a theme that comes away from the regrettable substitute. And we need to fundamentally rethink the trade-offs that we make. I mean, PFAS are a great example. PFAS are over-engineered chemicals. They provide oil as well as water resistance, but last I checked, that's not necessarily needed in a lot of the materials for which they're used. So there's that issue. I mean, the good news is there are companies entering the space, developing alternatives that really speak to hope, and they may scoop up market share from those who don't change their ways. So that gives me optimism. Terry, as always, really hits the bullseye by saying, is this an existential threat to humans and animals? I would say, if you don't cool the planet will not exist. I'm not going to mince my words about it. But if there's commonality between endocrine disruption and climate change, and that petroleum-based products are common to both phenomena. And at the same time, if we don't address the contamination and we cool the planet, we will leave a generation or multiple generations of people who are suffering from diseases and disabilities that further weigh them down and otherwise limit their ability to take advantage of a cooler climate. Let's see. Pete, if you're okay, I'm going to keep going.
Just add to that comment in response to Terry's question, that people will be very interested to know that Shauna Swan has a book coming out in February called Countdown, which is about the sperm count decline that's occurred in Western societies over the last 5 decades. A dramatic decline in male fertility, and the data aren't as good on female fertility, but there have also been declines. And if you project the curve forward, what you see is that the slope has not changed over the last 5 decades. It's always dangerous to make predictions, but if you venture to ask, if this were to continue without the interventions that remove endocrine disrupting compounds that are causing declines in fertility, young men will have difficulty having babies in the traditional way by about 2060. That's bad news. And if it continues, it is an existential threat.
And we've already seen campaigns in the Nordic countries for procreation with intent to compensate for decreasing population in certain countries. And not to mention other countries having concerns about population number. I would just...
One more question.
Sure. One more question to it. So I've only got time for one more question. I see. Thank you. So I would say I'm going to take the big, quickly for Anthony tweet, leotrasande.org and .com should both work. They both go to the same website, hopefully. I'll double check that, but .com is for sure going to work. So Andrea Larson asks almost a hope question. Why would I sound not completely pessimistic under the circumstances? We've seen so much change for the better. I mean, BPA free is all over labels, at least in developed countries. Now, you could argue that has led to a shift in to BPS and BPF and P and Z and the 40 or so artists formerly known as BPA. But that speaks to consumer responsiveness by the companies. You're seeing companies come into the space to compete out the players who are not doing well by the public. Those safe and simple steps are very empowering. For the PFAS, there was a massive report that admittedly on packaged food and fast food these days, which seems to be more the norm in the COVID pandemic mindset. But that got major companies, restaurant chains, to stop using those materials, period. And yes, it's a bit of embarrassment mixed with a bit of conscious positive goading that's required. But I've always remarked about the fact that these are studies of 5 and 10 products. It's not big scale science that drives these findings. You do need big scale science to prove the effects. But if you find out the fact that these chemicals are there, the public is very responsive, and the companies are often not the ones deciding on using the chemicals in the first place. They're buying it from somewhere else. They're the ones who also respond quite quickly. They don't want to have this egg on their face.
Great. Well, thank you, Leo. It's been a great presentation and remarkable work. I find it, having been involved in this field since 1990, I see that there is an exponential increase in understanding. And that's the only good exponential increase I know of. Usually exponential increases are bad, but this one is good. We have more understanding and more capacity to plan for a better future. So thank you very much. And I also thank the people who put up with our difficulties in the beginning. A video recording will be available on the Institute for Green Sciences website soon. And tomorrow you'll receive the attendees will receive an email confirming the link to the video. So thank you all, and especially you, Leo.
Thank you.